In today's topic, which is another part of the series on medication adherence, I'd like to talk about forgetfulness. Now, forgetfulness is a very common problem that seems to plague about 1 out of every 5 patients who struggle with the problem of non-adherence. And we have to mention here that this is one of the forms of so-called unintentional non-adherence. You can get both intentional and unintentional causes of non-adherence, and in this case we're dealing with unintentional. Now, with forgetfulness, we need to recognize that there are some specific risk groups, in particular the elderly, as well as patients who struggle with dementia. And in patients who were previously adherent and now suddenly become non-adherent, we have to consider dementia very strongly as a possible reason for this, and further testing may be required. Now, in thinking about how we handle or how we help patients, we usually divide the planning into 2 different groups, namely what the patient can do and what the doctor can do. And if we start with the patient, we'd like to help the patient make the taking of their medicine part of their daily routine. And one way of doing this is to combine it with something they do every day, such as brushing their teeth. So putting the medicine at the place where they put their toothbrush, as an example. In addition, one can also think about the nightstand, or take it with your food if that is appropriate and allowed. One could also think of setting reminders on your cell phone, or using cell phone apps, or using pill boxes that can help you organize your pills and see what happens. Then there are things that the doctor can do. One, we can simplify the medication prescription. For instance, use the medicine only once daily instead of twice daily. Use combination pills where appropriate, or use computerized tracking systems to check whether the patient has refilled their medication or not. Finally, we can also offer the patient a diary to monitor their own use of their medicine, or involve the help of family members or friends, especially in patients with dementia. If you have any other ideas on how we can help patients with forgetfulness, give us some comments below. We'd love to hear from you.